Oh, yes.
We're up and running.
Okay, so I'm Kat Harrington. I'm one of the relationship managers at Ordinance Survey. And my role is really to get all the public sector organisations that I work with, and I mainly work in the health sector, to get them started with using Ordinance Survey data, get them excited about using our data, and get them sort of the most benefit they can from our data. And I'm also joined by James Armstrong, who's our technical relationship manager, who's going to present with me today, and also Ian, who is our SDM, who's just going to sit and listen today. So please ask questions anytime. For some reason I can't see the chat. I don't know if it's been disabled or if it's so if you want to just shout out, please do put your hand up, whatever. I can see the screen, so just give me a shout if you've got a question at any point. And between James and I and Ian, we'll keep an eye on, if there's anything coming through the chat as well. So what I'm going to talk to you today about, so hopefully get you a bit excited about geospatial data. I know that some of you probably work with geospatial data, some of you might be very new to it. So I will go very briefly over what it is, also talk about what the Public Sector Geospatial Agreement is, or we call it the PSGA, what you get under that agreement, so what kind of products, what kind of support. And then I'm going to really focus on the National Geographic Database, which is our new way of providing our data to our customers. And then hopefully I want to spend quite a bit of the time actually talking to you about ways that you can use our data to kind of get you a bit interested in sort of things that you might be able to do. So for those of you that don't really use geospatial data and not really aware of it, it can be called lots of different things. So geographic data, location information, but essentially it's all the same thing. And it's about data about the location of objects, or it could even be events on the surface of the earth. And obviously within our Ordnance Survey, we really only focus on Great Britain. So that's our remit. And there's other organisations that deal with Northern Ireland, for example. So those things could be roads, houses, but you could even talk about things like COVID clusters, or where areas of crime are. But often that data contains attributes relating to that object. So it could be what that object is, a description of it, a name, a classification, a date that it was created, for example. But if you want to use geospatial data, you do need to have some specialist software. So lots of people use a geographic information system, which is a GIS. But nowadays, a lot more people, I saw there's a few data scientists on the call, a lot more people are starting to use the likes of Python and R to use geospatial data, and also some BI tools can also pull in geospatial information as well. So there's kind of very broadly, there's two kind of main uses of geospatial information. As backdrop mapping is kind of the very common use of OS data and geospatial information. So if you want to sort of give context to your information, you want to put your data onto a map to understand where those things are. So whether it's you're showing where GPs are, any type of health service, catchment areas, there is lots of Ordnance Survey data that can help you with backdrop mapping. But what we're finding more and more is people are using geospatial data for analysis, and lots of government organisations, a lot of public sector are now using the data to help them answer questions, make predictions and make decisions. And I'll talk through a lot of the data that will help you with that sort of thing. Okay, so just very quickly, this is kind of the more boring stuff, but very quickly, we do need to talk about the PSGA, because this is the mechanism by which you can get access to our data. So it's free for all public sector bodies to join, and some of you may already be members, and you can find out on our website, because we've got a tool that lets you type in your organisation name and it will tell you whether or not you're a member. So under that membership, you get free technical support, you get access to the data hub, which is where you order our data. You get access to pretty much all of our products free of charge, and our APIs, and also now the National Geographic Database, or NGD. So it's a 10-year agreement. You have a license that you will sign up to when you agree to join the agreement, but it pretty much lets you do what you want with that data. The only stipulation is you can't sort of sell on that data. So you can publish that data online, you can pass it to contractors. The licensing is pretty free. And as I said, there's lots of technical support. So you've obviously got myself, you've got James, who is a technical consultant. But if you just wanted to go online, just look at some documentation, there's loads of stuff on our website. We also have Gitbook, which has got lots of information about NGD. We've got something called More Than Maps, which I'll send you the link to later. And that is got lots of tutorials, but also some really good examples of how you can use our data as well. We have the PSGA help desk as well. So some of you may have spoken to the help desk. They're Monday to Friday. I think they work something like 8 till 5 or 6. And you can call them if you need help with the data hub, or if you wanted support with, one of the products, joining up to the PSGA, whatever it is that you might want. I've already said we've got technical consultants, but they can do anything from just showing you the art of the possible, to getting started with some products, to doing proof of concepts. And we've also got data scientists as well. So if you are using more of those kind of coding type tools like Python and R, they can also help with that too. And we even sometimes do secondments into PSGA organisations and help them with a particular project that they might have. So I mentioned the data hub. If and when you join the PSGA, you'll get a login to the data hub. And on the data hub, you can see all the different data sets and APIs that you can order. You can manage your orders, you can add new people to the data hub, so they will get their own login. There's an error reporting tool on there, so you can actually, if you notice any mistakes in our data, you can report it on there. And also there's lots of Q&A and documentation and support on the data hub too. As I said, if you want any support with that, you can either contact me and James, or the help desk are really useful as well. So I'm going to pass over to James to sort of go through some of the products that we have, and also talk a bit about NGD. Are you there, James?
Thanks. Yeah, I'm here. Can you see me all right?
Yes.
Brilliant. Okay, thanks, Kat. Hi, everyone. Yeah, so as Kat said, I'm James. I'm a technical relations consultant, which is a fancy way of saying geospatial consultant, which is a fancy way of saying I support our customers using our data and making maps, and everything that comes with that, down from just getting started with the data to bringing it into your core business processes. So we'll talk about PSGA products. So these are all the different data products that are available to you as part of the PSGA. On this slide, you'll notice there's quite a few, and I'm not going to go into detail on all of these because that will take days. But the key factor is that there is a lot of data available to you in lots of different themes. So if you can, next slide, please, Kat. So a few ones of particular interest to yourselves. So the first thing is addressing and location. So this is data we capture including Address Base Plus, Address Base Premium, NGD address, and this is very much where is everything, so where are all the addresses in the country. We've also got things like Code Point, which captures things like postcodes, postcode polygons, as well as boundaries for local authorities, counties, etc., you name it. We also have contextual mapping, so this is kind of the maps you kind of know and love, a bit like paper mapping, so what you see in the background, at different scales. So that can go from anything from as small as 1 to 250,000, all the way up to 1 to 250,000. So that's just the map in the background, which for anyone here who's worked with any of the ambulance trusts, for example, you'd often see the backdrop of things like command and control, but you'll see in a lot of other places as well. We then have networks, and this is both water and road, but also by walking as well. So this is a range of products to use for just showing you how to get from A to B, with everything from road restrictions, so how wide is that road, what vehicles are allowed down that road, what times of day, any long-term construction or works that will disrupt that route. through to things like what direction does this water course flow in, what tributaries does it link up to or break out into. I think I've used tributaries wrong there, but you get the idea. We then move over to topography. So this is, what is on the ground, and that is everything from buildings to land use to the physical nature of land and water. So, what ground surface is it? How wide is it? Area. And then for buildings, this goes into tons of more detail around everything from how tall is that building, the number of floors, is there a basement, how do you classify those buildings and land? The list does go on. And then something really important with all this data is identifiers. So how do you connect all this data together? So every address has something called the UPRN, unique property reference number, which tells you that is that address. But we have the same thing or similar things for buildings, for roads, for land, that helps you recognize what data you're looking at, but also join it all together and relate it. Next slide, please, Cap. Brilliant. So just to cover a couple of products that are going to be of particular interest to yourselves. So this one is OS Maps API. So this is an API that essentially brings in all of our contextual mapping from up to GB scale all the way down to 1 to 250,000, aka master map scale, which is on the screen right now on that GIF. And this comes in different styles as well. And what this is great for is just being a backdrop to any other analysis you're doing. At the end of the day, you still need to know where that data is. It's all well and good saying this is where all our hospitals are, or this is the ICB boundaries, but knowing how that relates to what's behind it. So this is available as a web map tile service and works with most web, mobile, and desktop GIS. But this ultimately is, the sort of the traditional OS Maps experience from GB to local scale. Next slide, please, Cap. So the one worth mentioning is the OS Places API. So I talked about that address data, and this is essentially that API equivalent. So this lets you search and explore address data for the whole country and verify that against our address-based premiums, our addressing database. And you can search that, and that can be by full address, that can be by postcode and UPRN. And that helps support things like fuzzy searching. So if you know half of an address, you can search for that and get that result out as well. And you can also do it geographically. So I only want to look at addresses within a certain area, be that a radius or a particular box or an actual boundary. This is all daily updated. So this data is, when we receive an update, be that from the local authority, be that from Royal Mail or so forth, when that gets fed through to our data, that is updated automatically. So you don't need to search and get that data updated. It is always the most up-to-date copy of those addresses. And that includes all the different attribution that follows through with that. So that's address classification from primary, like residential, to quaternary. So is it a flat? Is it detached, semi-detached? Is it house and multiple occupation? The list goes on again, as well as things like what buildings does that fall in again? What land use does that fall in? What local authority is that relevant to, and so forth. Next slide, please, Kat. So I think I'm back to you actually now, Kat, I believe.
This slide is just to show, there's just an additional slide to show how the API, the Places API that James just spoke about, is actually being utilised for patient registration within GPs and possibly some trusts as well, some hospital trusts. So what it means is that you're getting a clean address coming into the system. So when a patient registers, mistakes aren't being made, and I don't know, the wrong postcode's given or someone's misspelt something. It just means that there's clean data coming into the system, and so then if like a mail shot needs to go out, or something gets sent to that address, then it makes sure that it actually gets to that address. So that's how the Places API is being sort of used quite a lot at the moment. You're going to continue with the NGD, James?
Yeah, sorry. There you go. Brilliant. So something really exciting we'll talk about today is the National Geographic Database. So previously, you used to have to access a lot of our data in individual products. So if you wanted addressing, you'd take address space. If you wanted a map, you take OS master map topography layer. But then say you wanted to solve a question like, I want all of the buildings in the country, or I want all of the residential buildings. It'd be quite complicated to get that answer. You'd need to take topography, you then need to pick out buildings, check which ones have residential addresses. It goes, it's quite a complex kind of process. What we've created now is something called the National Geographic Database. It takes all of this data and puts it into one gigantic database. And I do mean gigantic. I think there might be some stats on the next page. And puts, all of the information that we capture, as well as new information, into this huge database that you could access as part of the PSGA. Next slide, please, Cap. So I'll explain more on the next. Got a fancy graphic. There you go. The NGD, improved data and structure. Next slide, please. Fancy. There we go. So what does that actually mean? So first of all, foremost, the NGD is updated daily. So with a lot of our other products, you have to wait to sort of 6 monthly, quarterly, some 6 weekly, and also a lot of these update cycles were being consistent. So, download this product this week, then the next week, that week. The NGD is updated up to daily. So you can take all of this data that you need as frequently as you want, but you can take that up to daily. It features sort of personalized selections. So we have a system called OS Select and Build, which again, I think might come up a bit more in a minute, which lets you filter that data by the type of feature, the attribution, so if you only want residential buildings of a certain height, you can do that. There's richer attribution to that as well. So it used to be that, for example, we captured just building height, but now we have things like the number of floors is based on the present, and coming soon, there's also going to be things like roof aspect, roof material. We just launched construction materials. So all this additional information is being brought into that data. And it all comes in easy-to-use formats, so GeoPackage, CSV, and GeoJSON. If you're not familiar with the GeoPackage and GeoJSON, they are two fairly common geospatial formats that are used by most geospatial platforms. And CSV, you probably already know, is an easy way to take any kind of form of tabular geospatial or other data anyway. Next slide, please, Kat. So I think we've already largely done this, but the key part of this, is that how do you access the data? So I mentioned OS Select and Build. So that is this new platform that lets you filter for data ahead of time. So rather than having to download a big product and then play around with it on your end, so I only want this geographic area with these buildings with this height, you can do that at the start on the OS Data Hub. So you can say, as I keep using that example, I only want residential buildings over 10 meters in this village. And you might even want to further classify that afterwards as well and say, I only want the ones near a body of water, or I only want the ones that fall into this local area. You can keep doing that, and it just makes getting those end results a little bit easier. And you don't need to, understand all the geospatial tools to get that answer as well. But we also have that data available again as another API. So if you want to play around with this data without having to download it all, you can load it in as an API feature service. And again, take out perhaps just the addresses you want, just the land you want, just the water you want, you name it. Next slide, Kat, and I think that's back over to you.
I think it is, yeah. Oh, there's a little bit added on there. Excuse me, I'm a bit croaky. So I guess one of the reasons why we created NGD was that we got a lot of feedback from customers who did a lot of user engagement over the last few years, or when the PSGA was being developed, to say we would like all these extra attributes. It's very tricky for us to put new data into current products. It messes people's systems up. And we have to give sort of a year's notice if we're going to make any changes to our products. So that's one of the reasons why we created the NGD, because it allows us to add new attributes to the database very easily. And we do this now on a 6 monthly basis. I think it's September and March. Correct me if I'm wrong, James. So we do a release every 6 months. So back in September, we had number of floors was added to the buildings theme. We had the structures themes. We had bridge interactions, which was added into there. So that's gives you information about what was going over a bridge. So is it train? Is it road and what was going under a bridge. Was it a river? Is it a path? And then in March we'll have a load more new attributes being delivered. Excuse me. So in March we'll have some more building attributes, for example. I think what James already mentioned, the roof information, so the shape of the roof, the aspect, what it's made from, has it got any vegetation on it, has it got solar panels on it, and I think that will be quite interesting to customers. And we're going to add some more information about access to public buildings. So we've already got some of that. So that is the site access, so whether it's vehicular or pedestrian, but also we're going to start having access to the actual building itself. So where are the doors to get into the hospital, for example. So yeah, there's some quite interesting new attributes that are coming along in March. That was a very quick whistle-stop tour of NGD, but what I'm going to do is talk to you about how you can actually use NGD. So that will hopefully bring out some of the attributes that we kind of glossed over very quickly, and you'll be able to get a bit more understanding about what NGD actually can give you. But before I do that, I just wanted to share this slide very quickly because I was interested to see if any of the health customers had actually downloaded any NGD data already. And so 43 public sector customers that are in the health sector have already taken an NGD theme or an API. And it looks like the APIs are very popular. So there's 19 customers who've downloaded or created a key for an NGD API. But it also looks like the buildings theme and the address theme and the land use theme are very popular. So it kind of makes sense with some of the stuff that I'm going to be talking about in a minute. So yeah, I just thought that share that quickly with you. So I don't know if we want to ask any questions at this point, if we're going to leave it to the end, but this might be a good pause time. But essentially now I'm going to talk to you about sort of some examples of how you can use our data. If there aren't any questions.
So Kat, there are a couple of questions because although people such as you can't see the chat, people can put them on the Menti. So possibly not to go through all at the moment, but there's just a couple of people who've been looking at your website. Because you mentioned just to see if they're signed up. I did the same. I could see that Midlands and Lancashire CSU are signed up, and my ex is also signed up. That's my ex, as in organisation, not relationship, obviously. Yeah. So if I just share, I will just share my screen, and then just take a couple of those without sort of interrupting your flow too much, just to make sure that we get to them. If you signed into Menti, you'll be able to see them anyway. But so the first question, if I'll just see how many there are. Okay, the first question you can see here is somebody who says that they've checked onto the website and their organisation has signed up, but they never heard of any of the projects. And how do individuals use the projects if their organisation is signed up? So like me, my organisation is signed up. So how do I actually use those individual projects, which sound amazing, by the way? Some of this stuff I can't believe this is available.
Yeah, no, it is really useful. So every organisation that's a member of the PSGA has what we call a principal contact. So it's the main person, and they're usually the person who signed up to the PSGA. And some people have signed up years ago, and that person might have left the organisation or doesn't use geospatial anymore. So get in contact with me or the help desk and find out who that principal contact is. Now, if they don't work for your organisation anymore, then we need to have a new principal contact and someone who preferably, does a bit with geospatial data. And then we can get you a login to the data hub, and that's how you can access all our products. But James and I are more than happy to have meetings with anybody, a half-hour Teams meeting just to go through some of this stuff with you. We're more than happy to do that. So I shall share all our details at the end so you can contact us.
That's really, really helpful. The second person says that they've signed up and registered, but they're getting a message. So presumably there's some issues with the people getting access, then they can contact you, or they can just
Yeah.
go to the site.
I'd definitely say if it's a data hub question, the help desk, the PSGA help desk are the best people to speak to, because they have admin rights to the data hub and they can sort things out. So sometimes if people haven't, so I think you get a link and it lasts for about 7 days to the data hub. And if you haven't gone and done that straight away, then it basically, you need to get a new link. So yeah.
Okay.
Quite
so I can see
sorted out.
Okay, brilliant. So there's just I think the company is probably been put by one of you anyway. So okay, there's some useful information here about who can sign up and how.
Okay.
So okay. Okay, great. So I think it's just to me this is a resource that looks incredibly useful, and I'll hand back over to you, Kat. I suspect people have existing access to it, but they don't know, so they need to find out more about that. And if they don't, then they can discover how to do it as well. Brilliant. I'll hand back over to you, Kat.
Thank you. I'll just reshare my slides. Hopefully that'll come up in a minute, but as it's loading, what I'm going to talk about next is oh, let's get to the right slide, just one sec. There we go. Yeah, so what I want to talk to you about next is how you can actually kind of use our data to kind of answer some questions. And James and I and Ian, we've been working in the health sector quite a long time, especially Ian. And the thing around the wider determinants of health and understanding where people live is something that keeps coming up and up again. And we talked to NHS England a lot about this, and UK HSA. So I just wanted to go through with some of the attributes that we've got in NGD that can start giving you a bit of a picture as to where people live. Now, this is going to be very granular, so this is down to individual buildings, but don't think about it necessarily like that. You can aggregate it to any level you want. I know that a lot of ICBs and a lot of other local health organisations don't work at that very detailed level, but you could aggregate it up to postcode or any kind of ONS geography that you want to. If you want help with doing that, then obviously that's something that we can help you with. So we've got information within NGD, within the buildings theme, around the number of addresses within a building. So that might be a flat, and you can see, therefore we can start to build an idea about sort of population density and how many people might be living in a particular area or particular building. We've also got information about whether there are private gardens linked to a particular address. And again, that starts to build up a picture as to what type of property is someone living. Have they got any access to personal green space or not? We also know the number of floors in buildings. So are people living in, a 2-story house, or are people living in a really tall building? And again, those sorts of things can have an impact on people's health and well-being. What property type? Is it, a semi-detached house, or is it, a mid-terrace house? Or is it a flat? Again, that gives you another piece of information as to what kind of building somebody, what kind of property, what kind of home somebody lives in. We've also now got this quite a new feature. We've got the building age, so we know roughly when a building was built. And again, it gives you some more information about that property. Are they living in a very old building, potentially susceptible to cold and damp? We know the construction type as well. So this is mainly what's on the outside of the building rather than what it's built from sort of internally, whether it's sort of a wooden frame, for example, but what's on the outside, we've kind of got that information. And again, it gives you a bit of an idea as to what house that person lives in. If it's non-standard sort of building materials, then, could it be perhaps, a colder property or something? But put all of those pieces of information together, and you're starting to build a really interesting picture of where people live. Now, I know there's other information out there, like the energy performance certificates that give information about this sort of thing as well. But there isn't an EPC for every property out there. If it's not been sold, it's not going to have an EPC. And if it's not been sold for a very long time, it may have a very out-of-date EPC as well. So we were just trying to think of how could we kind of demonstrate what our data can do if you're thinking about vulnerable people living in potentially cold, damp homes, and what are those attributes that I've just shown you? How can we pull those together and kind of maybe create an index of risk around homes that are more hard to heat? So we thought about, so I worked with one of our data scientists on this project. So we thought about the different characteristics that we have, and we thought about the building age would be a good one to add in there, because obviously, if it's older, it's not necessarily, but it might be more likely to have bad insulation, maybe an older boiler, for example. Connectivity. So I didn't show you actually this one, but there is another attribute that shows how many other properties a property is connected to. So that could be 0. If it's a standalone building, it could be 2 or 3 properties. So again, that gives us an idea about the amount of heat that might be lost through those walls. And building construction material definitely has an influence on heat loss, we think. So we pulled all that together, and the data scientist was working on this. Some of you may be familiar with Python. That's the tool that she used. She only pulled out the residential properties from our data. And she calculated a score per attribute and created this index. So the higher the number, the more hard it is for that home to be heated. The lower the number, the easier it is. And then she spatially joined the output areas, the ONS output areas, to the building. So if you wanted to see it at a more aggregated level, you could. And then we passed that to one of our data viz consultants, and she created some really funky maps to just check that what we had done was actually ringing true. So green properties are the easier to heat homes, and the darker the red, the harder to heat it is. So that dark red one, it's got a score of 3. It's pretty old building. It's timber or wood construction, and it's a standalone building. So yeah, it's coming out as we thought it would. So that in itself is kind of useful information. But it'll be even more useful at a more aggregated level. So this is the output areas across Southampton city centre. And again, red is the more hard to heat homes. And so if you wanted to put some intervention in place, you wanted to look at areas where you might want to knock on their door and, see if there's anything that can be done, you would probably concentrate on those red areas, and it gives you a very easy way of kind of seeing that information. So we showed this data to a number of people. We showed it to UK Health Security Agency. They are doing a piece of work around looking at care homes that are hard to keep cool. So the flip side, so they're looking at extreme weather events, and yeah, obviously vulnerable people in care homes are much more likely to suffer if it's very hot, inside a building. So they took this data and they're basically using the same sort of attributes, but kind of looking at it from a hard to keep cool perspective. So they're working with the university on that, and we're hoping they're going to be able to share their results at some point. That should be quite interesting. Have I got another 5 minutes or so? I'm not quite sure what time you wanted me to finish.
Yeah, keep going.
Okay, great. So this is the other use case I wanted to show you. So this is around using NGD to understand, delivery of health services and also commissioning. So we talk a lot about delivering services, deriving catchment areas, doing gap analysis, understanding where your patients are versus where your services are, even where your colleagues are, and doing this properly, sort of creating catchment areas is very tricky to do. But this slide is trying to show the difference between just looking at a straight line distance from a service and the difference to actually using the road network. So obviously, if you're using real world features, you're going to get a much better sort of accurate distance when you're kind of creating those catchment areas. So this point could be anything, you know, hospital, GP, pharmacy, whatever you like it to be. So things get even more accurate when you look at drive time analysis and speed data as well. So we've got data on average speeds of roads. And obviously you can even, if you want to go down to the really nitty gritty, look at different times of the day and the speeds of those roads at different times of the day. Now that's probably one step too far, but that is something that could potentially be done if you wanted to. So you've kind of got the drive time that's not using the speeds data, not using the average speeds data on the left, and on the right it's got the average speeds. So some examples of how kind of our road data has been used in the past, and this is actually walking times. So if you wanted to understand the distance to green space, we have got the path network as well. And we've got access points to green space. So obviously not all green space is completely fully open. You might have gates, you might have fencing around it. So this will give you the ability to actually route to a green space access point. And that's something that's obviously quite important during COVID, is like how much access do people have, or can you easily walk to a sort of green space? But we recognise it's really tricky to do drive time, walk time analysis. And we show this a lot to a lot of people, and they sort of want to do it, but kind of give up because it is very tricky. So recently we created the OS Multimodal Routing Network, or the MRN. And this is trying to kind of address some of those issues. So it's a brand new product, but it is specifically designed for routing applications. And it also has multimodal connectivity, which means you can go from road to path to bus and that sort of thing. So you can change the type of mode of transport. So the key features, as I said, it's a single data set. So that reduces the need for sort of lots of pre-processing work, and it's got those different modal networks. It's got things like in it, like the road restrictions and access restrictions, speed information as well. So, you know, things like one-way streets, that sort of thing. I've already mentioned the modal change points, but the other benefit of this is that it comes in OpenStreetMap schema, was created in OpenStreetMap schema. So it means it's a lot easier to get into different types of tools. So there's lots of different use cases for this, but obviously within the health sector, you know, creating catchment areas, that sort of thing would probably be your main thing to do with it. Sorry, just get through that one. So I think I've probably gone through most of this. Just trying to think if I've not mentioned any of it. Yeah, I think I've probably mentioned most of the benefits already. Yeah, the main thing is that it's supposed to be simpler to use and more out of the box. Now, with most tools, it is easier to use than some of our previous products. So, for example, within Graph-Hopper, which is a more data science coding type tool, it's quite easy to use in there. We've actually got some documentation on how to use it in there. You can also use it in things like QGIS or Esri. And there's another example here how it's used in Open Trip Planner, bringing in some of those kind of bus timetables and things like that. Now, if you're interested in MRN and you've got something like QGIS, which is an open source GIS, I'd really recommend to go to More Than Maps website, which I've already mentioned, which is where you can see tutorials, you can see examples of how our data is used, and we've got some documentation on how to load in the MRN into QGIS to create catchment areas, if that's something of interest to you. It says walk time, but actually it is both. I clicked on the link and I looked at it. It's actually both drive time and walk time. Okay, I've got one last slide, if that's okay. So now that's still well and good if you sort of have used geospatial data, if you understand geospatial tools, but it still doesn't help people who are non-geospatial experts. So me and my colleagues and the data science team are looking at this idea of a travel time lookup. So we would essentially use the MRN data to create a lookup. So from one grid square to another grid square using the MRN data for walk time and drive time analysis. So this would remove the processing work that a lot of users need to do. It would make it easy for sort of non-geospatial experts to use. It would give you the ability to put in your own location. So you'd have to select which grid square is your starting point and which grid square is your end point, and you'd get the distance and time for those. We would use walking and driving as well, and it's platform agnostic, so you can use it in other things. So it'd basically be a big table of data, a very big table of data. So this is something that we are investigating at the moment as to whether we can do it. We all think it's a really good idea because it would, as I said, it will just open up our data to a lot more people. It will obviously be pre-canned, so it will need to be updated at some point. Road data doesn't change a huge amount, but it will obviously be needed to be updated at some point. So most people we've kind of talked to this idea about have been quite excited and thought this was a pretty good idea. So if we do manage to get a proof of concept, if we manage to get some data, we'll happy to come back and let you know about it, and you're more than welcome to test it and look at it. Obviously you would need to be a member of the PSGA to be able to do that, but yeah, that's the plan, and we're hoping that we're going to be able to do that. I think I'm done. So if there's any questions, obviously let me know. I've put James and I's email address and the PSGA's email address on that slide, and also the address for More Than Maps as well. But obviously, you know, give us a shout if there's anything else that you need. Shall I leave that up there for a few seconds that people can note that down if they want to?
Okay, thanks very much, Kat and James. That's been a fascinating journey into what is a is it a new project, this that you've been describing today? Is this something that you've been working on for some time, the way you've collected together existing resources?
Do you mean the NGD?
Yes.
Yeah, so NGD's been around a couple of years.
Okay.
We call it new because it still feels quite new compared to some of our other products. And some people that are, even though they might be members for a long time, are still not really fully aware of what the NGD is. So it's newish, but it's been talked about for a long time. But yeah, there's always new attributes coming through. As I said, every 6 months you'll get new attributes coming through, and every time there's a release there are workshops to talk you through how to use those, what they are, and then how to use those attributes and what they might be useful for. So they're quite technical workshops, but we send those out in the newsletters. That there's also a newsletter that goes out every month to PSGA members, and all lots of useful information on there.
No, it does feel like, so it must have been a few years basically since I've been using a mapping tool or mapping data, and we use them a lot, and obviously people still do in public health for targeting sort of cohorts of the population, so forth. So you'd be taking your data and you'd be overlaying it with morbidity data or people who are registered to asthma registers in GPs and things like that. So there's just like there's so many different things that you could use that data for. So yeah, it feels like it's moved on. It feels like it's moved on a bit. But I wonder if the questions that I used to have were still are now answerable. For example, you talk about using the data for catchment populations. Obviously, that's really important. We're just doing I know different people have had different ways of, for example, establishing hospital catchment populations. So I probably haven't got time to go into it now, but I'd be interested to sort of see what that approach looked like and how the results varied if you did it like that or if you did it in another way, because there's different ways of doing that as well, aren't there? So I have a couple more. I realise I've got a million things I could ask you, Kat. But I'm going to be very polite and hand over to who's been asking a question in the room. We have a hand up, and I think it's Simon. Is that right?
Hello, can you hear me?
Yes, I can.
Thank you for the presentation. I'm sorry if I'm jumping ahead of the other questions. 2 questions. When you mentioned addresses, do you have names and addresses like the post office or not in your maps? So could I look someone up?
What, the person's name who lives there?
Yes.
No personal information or no.
No, that's fair enough.
Yeah.
And I was just also going to just shout something out. I assume your tools are sort of tool agnostic, but Power BI this year has released a new tool that means you can track someone's journey, which is very interesting. So you could look at how, so if we say it's a bus, you could use the start time of the bus and follow the bus route and what time it came to. So using this sort of geospatial data, we could do the same with a patient and see, well, they went from this hospital to that hospital and on again. So I found that very useful as an idea. I'm not sure if Tableau is doing the same, but yes, thank you.
Thanks.
Thank you, Simon. Yeah, my daughter does that with her buses in the morning, so she sees where her bus is and whether or not it's going to be on time, and if it's not going to be on time and she's going to make herself very, very, very late for work, it's like, Mum, can I have a lift? So she uses that evidence in a very practical sense and in a nice, warm, comfy car as opposed to on a crowded bus. Zoe.
I just wanted to clarify. So sorry, with you asking about names and addresses, I don't think even the Royal Mail knows who lives in which address, just to sort of say that I don't think that data exists, because it's one of those things that you might start looking for and it's just not there. And the other thing is there's a local health access tool, which was from Public Health, as it used to be Public Health England, and it's possibly UKHSA now, I'm not sure if it's them or OHID, that do the drive time for buses, I should say, bus times. So that can be really useful, just to say that there's other stuff as well, but obviously these complement as opposed to, say, use one or the other. It's just that it's useful for people because this is being recorded as well, so that people might see
absolutely.
that data.
Yeah, absolutely. Thanks, Zoe. That's really helpful. So yeah, like I said, I have several other questions I realise I will save for another day. But thank you ever so much, Kat and James, for sharing that with us. I think you're going to get a spike in interest and hits on your website straight after today. Somebody was asking for a friend if you can identify off-street parking, but we can deal with that another day. And I will just very, very quickly just move on to say what we've got coming up. And so we've got Kevin Dunn from the Health Data Research UK Midlands, and that's our next session. We got an introduction to a shiny tool called Complex IT, and that's following that. In the new year, we've got Sam Riley coming to talk to us about making data count and loads of other exciting things coming up as well. So thank you very much again, and thank you everybody for coming. Thank you for the backup, Zoe and Jack, in case everything failed. And of course, because I've got backup, everything's fine. But F5 it is. F5. Fantastic. Have a great day, everybody, and see you in a couple of weeks.
Thanks very much.
Bye.
Thanks,
Bye.
Thank you.